Okay, let's start sharp on time. Welcome everyone to the first session of the Mastering Mobility series in 2022. My name is Verena Knöll. I work for the Mobilize Your City Secretariat based in Germany, and I'm responsible for capacity building and methodology development in the Secretariat. As I said, this is the first session of this year, and you will learn how to answer the question, how walkable and bicycle friendly is your city? It's actually the second part of a series of 3 sessions that Mobilize Your City is preparing together with the Institute for Transport and Development that are focusing on active modes of transport. So we already had a session on introducing benefits and barriers to active mobility in December, but don't worry if you didn't join that session. First of all, you can rewatch it later, but you should also be able to follow this session without having heard about the things that we discussed in the first session. So this session, as I said, is all about diagnosing active mobility. And before we dive into the topic, a few housekeeping rules beforehand. First of all, it's important to notice that the session is being recorded. So if you don't want to appear in the recording, you should turn your camera off and also don't use the microphone, because if you would do that, you'll be part of the recording. So just please be aware of that. It's also, of course, recommendable to leave your microphone turned off if you don't want to contribute to the session, because that often creates some disturbance. If you want to contribute to the session without using the microphone, you can always use the chat and just type in your questions in the chat or your comments, and we will get back to that and answer that. We will also be sharing some resources in the chat ourselves, and feel free to let us know about any interesting publications or tools that you might also know for this topic. And first of all, to make a little exercise of using the chat, you can already introduce yourself in the chat. Let us know who you are, where you're joining us from, and to give you a little bit more context on who we are. I trust that some of you might already know Mobilize Your City, but we are a global partnership of 65 member cities and 15 member countries, founded at the COP21 in Paris. And the partnership is jointly co-financed by donors from France, Germany, and the European Union. And I'll use this as a reminder to keep your microphone turned off, because we currently have some background noise here. We work together with our members to develop sustainable urban mobility plans and national urban mobility policies. And if you're interested in learning more about the partnership and our work, I recommend you to visit our website and learn more about what we're doing. And I'll ask my colleagues from Mobilize Your City to also go through the list of participants and maybe unmute people, mute people that are currently maybe having their microphone on as they're joining, so that we don't have these background noises. But of course, make sure to visit our website only after the session, because if you do it now, you will miss a lot of our interesting content that we have prepared for today. First of all, the session is going to last for 90 minutes, and we will start by introducing the importance of diagnosing for active modes of transport. And before we look into precise tools, and we are also going to test these tools so that you get some exercise and experience in using them. We will then look at how these results can be applied, and this will be done by case studies from 2 colleagues who are joining us for this session, before we then have a short conclusion prepared at the end. The objectives of this session, you can find them here, are first of all to create an understanding for the importance of diagnosing active transport as a part of sustainable mobility planning. And secondly, we hope that we can also enable you to conduct a diagnosis and to apply the results of the diagnosis in urban planning yourself. So for this session, and to help us reach these objectives, we have a number of amazing guest speakers today with us, all from the Institute for Transportation and Development, also known as ITDP, which is a global nonprofit organization and also a knowledge partner of Mobilize Your City, working on implementing sustainable transport systems with a focus on walking, cycling, and public transport. And as you can see here, we have 3 people joining us from ITDP today. First of all, it's Jacob Mason, Research and Impact Director at the ITDP headquarters. in New York, I think that is. Then we have Ghani Antasaputra joining as a transport associate from ITDP Indonesia, and Regatu Solomon from ITDP Africa, a transport planning associate who will also be here today and share her expertise on this topic. So welcome to the three of you, and I will directly hand over to Jacob to introduce us into the topic, and yeah, not to lose any more time before we dive into the diagnosis.
Thank you, Verena, and I'll go ahead and take over the slides now. Okay. All right. Can everyone see my screen now?
Yes, we can see it.
All right, thank you. And again, my name is Jacob Mason. I'm the Director of Research and Impact at ITDP, based in Washington, D.C. So as Verena mentioned, we'll be going through three parts. First, introducing you to some of the tools and why they're important. And sorry, we'll do the introduction to why transportation is diagnosis is important, and we'll look at the tools, and then we'll look through some case studies at how those are applied and how they influence and are part of the SUMP process. So in this section, we're going to look at why we need active transport diagnosis tools and how they can inform the SUMP process. So the next, first, just a little bit of background on active transport. As we went through in the first slide, it's a really important part, the building blocks really of the transport system. Walking and cycling are open to all at a very low cost or no cost, especially walking. In some places, many people walk long distances, often in not great conditions, sometimes because they can't afford other means of transport. Walking and cycling really are the feeder modes for public transport. And so together, walking and cycling feeding into public transport really provide the building blocks of transportation systems throughout the city, and really can be alternative to a way to reduce pollution and some of the other traffic injuries and deaths of mass motorization. So you can see some places, though, people walk because they have to. Some places people can't walk because it's really hard to walk. And especially as people gain more wealth, they often don't. They move away from walking and cycling. So we want to talk about how to figure out where your city is so that you can create a transportation system that is as sustainable and equitable as possible. Diagnosis is really important to understand where you are so that you can figure out where you're going. So the SUMP process is all about figuring out where you want to go, but you have to start out with where you are. So in this workshop, we'll help you understand what the current conditions are for walking and cycling so you can understand how to improve them. So first, we're going to start off with just a short quiz. So NMA, maybe you can add this to the chat, but you can also use your phone to go to this link. But I just want to get a sense of the participants. What percentage of trips in your city are made by walking? So you can just go to this link. You can either type the link into a web browser, or you can use your smartphone to pull it up. But just a general sense of what people know about their city in terms of walking. So if everyone could go ahead and do that. And then maybe if you could also add in the chat, what, how you know this. Did your city do a survey? Is this just what you think from your own observations? What you've heard? So I'm going to go ahead and pull up the survey results. Hopefully there's some people coming in. So yeah, we're starting to see the results coming in. All right, some people say 25 to 35% of trips. Some people say 35, more than 35% of their trips. Some people say less than 5% of their trips. Some people aren't sure. Okay. So I'm going to jump over to the chat to see if we can see the people have some people would say they got this from surveys. People have gotten this information from a number of different means, so that's interesting. I'll just give it a few more seconds. Final inputs to this survey. So we're seeing a lot of people with the 25 to 35%. Some people aren't sure. So now I'm going to switch to another question. So keep that window open that you have the survey in. So I'm going to ask one more question. And this one's a little bit different. So this question is, what percentage of trips in your city include walking? So not just ones that are done by walking exclusively, but include walking. Right, so we see some that are more than 35%, some are not sure, less than 5%, I see, more than 35%. And again, I'm curious to hear how you know that and what you think. So just to point out that, you know, thinking about, as you complete this, think about the whole trip. Is there, you know, if it's a transit trip, do people walk to the station? If it's a driving trip, do they walk from a parking spot to their final destination, or walk to a parking spot? Okay, and so what I'm seeing is a lot of people are saying more than 35% of their trips. So the overwhelming majority of you are saying that most of your trips, or at least a large percentage of your trips, have some sort of walking component to them. So I think this is interesting, and some people are not sure. So I think this is a good starting point for thinking about walking and cycling in the city. I'm going to switch back to the presentation. So as we think about diagnosis, one of the big reasons for working on diagnosis is that it can draw attention to walking and cycling and why they're important. So we heard from you all that different people know different amounts about what walking is, how many trips are made by walking in your city. Mobilize Your City did some of these direct technical assistance with cities and found that in some places like Ahmedabad, almost 40% of all trips are made by walking and 10% by cycling. But if you look at streets, there's still a big disparity between what the actual trips are and how the street space is designed. So you can see that despite most trips being made by walking and cycling, the streets don't necessarily reflect that in all places. So diagnosis can help draw attention to that discrepancy. We can see in this slide, and I hope you can read the whole thing, that in a lot of places the same is true. So these are at least a lot of the samples of the Mobilize Your City cities, and you can see that on a lot of them, a very large percentage of trips are made by walking, and in some cities, a lot of them are made by cycling as well. And this helps to understand the importance of those modes as we start to think about sustainable mobility plans. Diagnosis can help show new perspectives on a problem and the reality of what's actually happening on the streets when people use the system. We often have an idea of how our transportation system should be used or ought to be used and how we think it will be used, but diagnosis can understand how it's actually being used. So this is a photo of a pedestrian bridge in Erode, and I think the idea behind building this pedestrian bridge was to make for a safer crossing across this street. But in reality, when you look at the actual street, people aren't using it. People are crossing on the street. And so when this bridge was built, the street at grade was not designed for people to cross there. And so it's actually less safe with this design than it was than it would have been had they designed for a safe crossing at the street level. Diagnosis can also show things that aren't always evident from walking around. So this example in my town of Washington, D.C., you can see a yellow dot for a transit station. It's a metro station in the middle, and then a circle of a short walking distance. And that's a theoretical walking distance if you were able to walk straight across. But the problem is that the street network doesn't go straight across and doesn't connect directly to that yellow circle. So the reality is that only the places in blue can be reached in a short walk distance from that station. You have a whole bunch of houses, it's over 1,200 houses that can't be reached within a short walk from the metro station because there's just not streets that connect to them directly. And so this kind of diagnosis can help show that problem, which may be hard to see just walking around or asking people. Data collection is also a chance to engage with people. So by talking to people, including them in the process, you understand their perspective, and they become part of the process, and they understand that you're trying to see the transportation system from their perspective and involve them in the planning process. And so that can lead to better transport plans and better sustainable mobility plans. So as I mentioned, diagnosis is the first step when you're creating a sustainable urban mobility plan. So this is from some guidance from Mobilize Your City. So you can see there's 4 main steps in preparing a sustainable urban mobility plan. The first step is preparation and analysis. And so that's what we're going to focus on in this presentation. But a lot of the tools that I'm going to talk about, also relate to developing a vision and goal setting, planning which measures that you're going to implement, and then actual implementation and monitoring, which is number 4. So I'm going to refer to this image a lot during the rest of the presentation to show how the tools fit into the SUMP process. And so, as I mentioned, walking and cycling diagnosis specifically is an important part of creating effective SUMPs, sustainable urban mobility plans. And so this is just from guidance provided by Mobilize Your City on diagnosing walking and cycling, and that they are really important part and critical to developing an effective SUMP. I'm not going to read all of this, but this is just to show you that they're really critical to developing a SUMP. So another way that sustainable urban mobility plans are really important to diagnosis, the way that diagnosis is important for creating SUMPs is that they help to create a more comprehensive transport plan, both as independent walking and cycling trips, but also as a way to extend public transport trips and to create a more integrated and effective transport network. So this is an image, not to pick on Panama, but this is an image from Panama City in Panama, where there's a new metro system that opened. But as you can see, there's no facilities for cycling, and you can see on the sides here, the infrastructure for walking is not particularly great. It's often covered in parking, or there's urban greenery that has overtaken the whole sidewalk, or it's covered in driveways and storage. Which makes it harder for people to actually access the metro system, despite spending a lot of money on it. So having a more comprehensive diagnosis of the conditions can help create better plans and build more effective and complete transportation systems. So diagnosis can help establish a baseline. Again, this is from SUMP guidance. So this can help you understand what's working well, what's not working well. There's some basic areas of assessment that are really helpful. So looking at the quality of infrastructure, safety, environmental and health, equity. And then as you go forward, you can look at the status of measure implementation. If you already have measures in place or in progress for those modes. So say you're building out a footpath or sidewalk network, you can understand the status of that, what's in the works already. And so that can help you in developing guidance. Diagnosis can also help you set targets, and then monitor and evaluate progress towards those targets. So by understanding where you are, you can then understand where you want to go and then how you're going to get there. Talk briefly about the 4-step model, because diagnosis data can help you in that modeling process. As you collect data, say from counts of people walking and cycling, then you can help. They can fit right into a planning model for your city, but there's a lot of caution that goes into that. 4-step models are tools and have to be used carefully. So if your model doesn't include walking and cycling, it's not going to create results that help to favor walking and cycling. If your model doesn't have goals for access, so getting places as opposed to moving quickly, then the results will only favor the goals that you've set. And so within transportation, the point is not to go fast in the transportation system. The point is to help people and goods get to where they need to go. So as you set goals for 4-step modeling, you really need to make sure that the goals are all about getting places, not moving quickly. We also have to be careful for walking and cycling specifically. Often there's a zone-based approach to the 4-step modeling process. So a lot of walking trips especially, but also cycling trips happen within a shorter area. And so if your model only looks at where trips cross these kind of zone boundaries, they won't show up in a 4-step model. And if you're not counting those trips, then you're not valuing them. So you have to be careful about creating smaller zones for walking and cycling, so we're actually counting those trips and valuing them. And then the last thing about modeling is that, if your modeling assumes that that car growth will happen indefinitely, then you will plan for that. So this kind of goes into another point, which is just that what you're diagnosing and planning for leads to what city you'll get in the future. So if you're planning for cars and traffic, then you'll get cars and traffic. If you're planning for people and places, you'll get people and places. And I would just add, if you plan for walking and cycling, you will get walking and cycling. If you're not planning for walking and cycling and diagnosing for walking and cycling, you won't get walking and cycling. So this is from Fred Kent from Project for Public Spaces. It's a favorite quote of mine. So just quickly looking at why diagnosis is often not done. It can take time to do it. And if you have limited staff and limited resources, that might be a big barrier. It can take money. So sometimes it can be expensive to do this data collection. You need political support to make it happen. There may be also some restrictions at the government level on what is required and what is allowed. And so if you have minimum standards that only talk about measuring cars, it may be easy to just do the minimum. And there's also biases in the existing tools. Often they come from the United States, where I'm based, and some of them may favor motor vehicles over other modes. But the good news is that there are diagnostic tools that can help overcome challenges. So if you're already, as part of the SUMP process and part of the planning process, doing things like household surveys, you can add walking and cycling to those surveys to make them more comprehensive. There's also new data sources that I'll talk about that can help you understand your city better using new data. There's visualizations that also help you understand your city quickly and can reduce the cost and time burden. And those all can help you quickly understand and collect important data on walking and cycling. So, and so these tools help bridge that gap. Some of them you already use and some are new. So as I mentioned, there are surveys, lots of different types of surveys. You can read them here. Counts of how people actually are moving, how many people are moving, where they're moving. There's big data sources, which is things like from social media or from phone companies and media companies, and spatialized data that help to bring all the information together. And then finally, when you have this data, then it can be incorporated into SUMPS, local area planning, as really part of the sustainable urban mobility planning process. These can help you fix problems, find new solutions, and as I mentioned, by engaging with people, it can help build political will for the resulting mobility plans. And by engaging with constituents, with residents, with the people that live there and talking to them, you can help understand their needs in a more detailed way that's more accurate to what is actually experienced on the ground. So now I'm going to move quickly into diagnostic tools. So digging into more detail about the actual tools themselves. So this is designed to be an overview of important tools to help understand existing conditions. This is not comprehensive. We're not going to train you on all of these. It's too much for the amount of time we have. But we'll do some exercises with one or two of the tools so that you can understand them and we can start to talk about how the tools are used. So jump right in. So one of the first things is understanding the mode share of a city. So we saw the graphs earlier that showed that in Ahmedabad, 38% of trips were by walking and 10% were by cycling. How do you get that number? Well, one way is to do household surveys where you go around to different neighborhoods throughout the city and you ask people, how do you get around? These should include explicit questions on walking and cycling, and they can be a really important part of the first part of SUMP planning process. So this is a household survey that I helped do in Nashik, India. For household surveys, it's really important that you ask about multiple aspects of trips. As we talked about in the beginning in the first poll, many trips have walking and cycling portions of them. And so if you just ask the overall trip, you may just hear that someone took the bus, but often and almost always people walk or cycle to get to the bus or to get to other trips. So breaking trips down into their pieces can be really important. There's some other good guidance, such as it's hard to remember trips from a long time ago, so asking about recent trips is really important. And then thinking about how people think about those trips. So do people know how long they traveled in terms of meters or kilometers, or are they thinking more about the time in minutes? And there's also, it's all important to think about who you're asking. So women make a lot of trips in households, but there's many places where men are the head of households and only talk about their trips. So making sure to find time to include all of the trips made by different household members can be really important, especially when women make more walking and cycling trips in many places. And so this just gives an example of some of the forms. So like the previous one, this is a form that we created that helps to understand. This one shows a little bit more of a qualitative data on how people think about their trips in a qualitative way. So this is a good way to understand if people feel safe walking, if it's shaded, and how, if there's societal attitudes such as like cultural biases against walking and cycling. This can be an important way to understand that. So traffic counts, as I mentioned, can be an important way to understand walking and bicycling volumes. So this is a good way to get the more quantitative data. So how many people are walking and cycling? Where are they walking and cycling in specific streets? There are lots of different ways to do this. They range from standing on a corner with a clipboard and just writing down whenever someone walks by, to using videos like in this image that detect people walking and cycling, and lots of things in between. So these vary in terms of the cost and time required. And so we could do a whole webinar on how to do traffic counts, but I won't do that right now. But just to say that this is an important way of understanding how people are moving about and walking and cycling in your city. We also have focus group discussions. So this is a way to get more qualitative information about walking and cycling in a city. So you can select key representatives from different groups in your city, and you can gain insight into their perspectives. It can be particularly helpful for groups such as people with disabilities or people with lower incomes or from specific communities that you want to understand better, whose views might not come across in larger household surveys. It can also be an important way to understand how governments understand the transport system and how they interact with each other. And you can get clearer senses of strengths, weaknesses, opportunities, and threats with regard to walking and cycling. Sometimes these can take some time to plan, but they can really help provide valuable insights. And so, like the traffic counts, we'll talk a little bit more and hear more detail about how these were done in the case studies. But this is just an example from Mexico City of a focus group discussion. Now I'll talk a little bit about some of the tools that we've developed at ITDP. This is Pedestrians First, a large-scale mapping tool. And so by bringing together open source data about walking and cycling in a visual way, it can help you to understand your city pretty quickly and save you time on the diagnosis of your city. So we pulled open data from thousands of cities around the world, specifically related to walking conditions, to help identify where there are big gaps and areas for improvement. And so by having the data in a easy to use format, it reduces the need to collect this data yourself. So there's 4 sections of Pedestrians First. The portion I'm talking about is the View City Measurements section. So again, this helps with analyzing data and diagnosis, but as I'll show you, it also can relate to goal setting and measure planning. Let me go to the next slide. So this is a view of the tool from Pune, India. So this shows, this is the first section which shows data on the density. So darker pink and purple is denser areas in the city. And then at the top, you can see a overall a sum total of the density in an average neighborhood where someone lives. It's 32,000 people per square kilometer, which is quite high. For the tool, we've included some goals based on some best practices to give a sense of where a city might go. So as I mentioned, this can be a way to also help in further aspects of the planning process, the SUMPS process, by helping to establish goal setting. In this case, there's no need to think about or worry about density in Pune, it seems, since there's already quite a bit of density. But as you see in the next slide, the tool can help identify places where there are gaps. As I mentioned earlier in the slide, having a good street network that's well connected can help make distances shorter for walking. In the Washington, D.C. example, the people weren't able to reach the metro station even though they lived close to it as the bird flies, but they weren't able to reach it in the short distance because the street grid wasn't very well connected. So this is a measure of how well the street grid is connected, and you can see visually on the map how it is connected. The darker blue is more connected street grid, and the places where it's very light or not existing at all has very, very low street grid connectivity. And so you can see in this slide, I showed a red circle. In the previous slide, it's a very dense area. There's a lot of people that live in the area. But when you look at the street grid, it's not very well connected here. So you can use this kind of analysis to identify places where, oh, maybe we need to create some better connections on the street grid, especially in places where there's already a lot of people. So this can help with measured planning as you think about, okay, where do we need to actually make improvements in the city? Okay, so now I'm going to skip to another diagnosis tool. This one is more focused on cycling. So this is the Grow Cycling Toolkit that we created at ITDP. And this one's available in Chinese, English, and Portuguese. And this is an online toolkit which provides a citywide assessment of cycling conditions in a city. So it's designed to analyze and examine a variety of different aspects of cycling to help cities understand and prioritize policy measures to help grow cycling in their city. And then the tool links directly to guidance on how to implement those policy measures. So it follows a very similar approach to developing sustainable urban mobility plans that should help make it easy to incorporate the results of this into the SUMPS process. This toolkit can be used anywhere, and it's a self-assessment tool, and I'll talk about that in a second. It's not proprietary, and we can explain how all of the measures are weighted and how it all works. But we would just encourage you to take a look as you think about planning cycling in your city. So I'm going to jump into the tool itself now. And so maybe here, before I do that, you can just see there's first you start off with the city assessment, and then you get action plan, which is related to measure planning, metrics, which are related to implementation and monitoring. So it's very directly tied to the SUMP process. So first you do a citywide assessment. So you use your own judgment of your city and maybe the results from household surveys to talk about different aspects of cycling, from access, security, safety, awareness, physical conditions, capacity. Capacity being how well the government's able to support and implement cycling measures. And then from that, you get an action plan. You get priorities for what to do. And each action in the action plan shows you how well it shows you the amount of impact it can have, how much time it takes to implement, and the cost. So, and this relates to the third step in the SUMP process, which is planning different measures. And there's also, this tool also gives you detail on what that actually means and links you to resources that help you to implement the measure. So then the tool also provides metrics. So how do you measure where you're going? One of the key components of SUMP planning is vision goal setting. So this isn't really as related to this presentation, but just while we're talking about it, just wanted to highlight that the Grow Cycling tool also identifies key goals that can be important to the SUMP process, including increasing access to destinations, improving safety, and similar goals. And then in the action plan, it provides, as I mentioned, it links you to resources for how to actually implement a lot of these measures. So as you see on the top right, these are guidance from ITDP and from other organizations like UNEP and FIA on how to implement better cycling infrastructure and implement cycling measures in your city. And again, that relates to measure planning as part of the SUMP process. Another important diagnostic tool is looking at road safety, specifically road crash data. So this can help show where there are specific safety issues. So you can collect this data for a city if it's available. This usually is something that you have to find data for. You can't go out with a clipboard and collect this data. But it can show you where there are specific issues that might need to be addressed in the planning process. Often this shows that places that have larger streets that are busier and higher speeds tend to be the worst. The data availability for this can really vary quite a lot. So you have to be careful at how understanding what it means and understanding what the limitations of it are. But it can be really important for targeting safety improvements as part of the SUMP process. And so the last tool I'm going to talk about is the TOD standard. So to understand more detailed data about the physical conditions of walking and cycling in an area, so you can consider using the TOD standard, which is a tool that ITDP developed with experts on walking and cycling in cities. This one's available in Chinese, Bahasa Indonesia, English, Spanish, and Portuguese. And it's based on 8 principles, which you can read about here. I'm not going to talk about all of them, but each principle includes a set of elements that can be easily measured on the street and assessed in an area. So they can be visually measured by walking around. But this is more on the the physical environment, what exists, and less about how people are using it. So to show how these elements that are, especially those relevant to walking and cycling, can be measured, we'll look at two of the principles in detail and some of the data that can be collected for those measures. So in the tool, walk is the first principle, and there are 5 elements of walking that can be measured, and you can read each of them here. And these can all be measured through direct observation. So you can walk through a block and see what is there and make a note of it as you measure for your city. And so we're going to look really quickly in the next slide on the safe all accessible walkway metric, which is this one. And so in the tool, it provides guidance on the data sources you can use. It provides a goal for the metric. So the goal here is 100% complete all accessible walkways. Data sources can be plans and maps, satellite photography, as well as a site survey, so going around on the site and measuring and recording information yourself. So in the tool, the metric is to have 100% complete all accessible walkways. So there are no barriers to walking. The sidewalks are wide enough. They're not blocked. The surface is level so that you can go on them in a wheelchair. There are crosswalks to cross the street. And they're well connected, so you can get from one sidewalk to a different part of the sidewalk on a street. So now we'll go to an exercise that looks at a specific sidewalk. And what I want you to do is to take a moment, take a look at this sidewalk. And this is one in Pune. And this specific area was rebuilt later. But I want you to do is quickly take a look at this picture, and in the chat, let me know what you see. You can use a plus sign to show something that's positive, or a minus sign to show something that's negative as it relates to the 4 categories. So the first one is accessible walkways. Is this an accessible walkway? Can you walk on it? Could you use it if you're in a wheelchair? Could a child walk on it? The next one is visually active frontages. And this just means that if you're walking on the sidewalk, can you see into the buildings? Can people inside the buildings see out? Is there activity on the street that helps provide activity and safety for people walking on the sidewalk, or is it desolate blank walls? The next aspect is that you can think about and note in the chat is physically permeable frontages. Are there places to enter and exit buildings right on the sidewalk? Are there lots of them, or is there just maybe 1 or 2 along the whole block? And then the last one is shade and shelter. Does this sidewalk get really hot in the summer with lots of sun on it, or is there shade? Are there places, if it starts raining, to duck under? So just want to jump over to the chat to see what people are saying as you take a look at this. So there are people have talked about cars are not parked on the sidewalk. People have said that there's good frontages. Is there anything negative about this image that you see? Anything that could be improved? Think about the condition, and especially think about people who might have challenges in using the sidewalk. Maintenance, sidewalk quality. The paving on the sidewalk. All right. So I'm going to go ahead and go to the next slide now. Thank you so much for looking at this and thinking about this. So the next aspect in the TOD standard that I want to talk about is cycling. So the cycle metric, the cycle principle measures and encourages cycling amongst all people, but especially caregivers. And there's two elements that are safe and complete cycleways and cycle storage and parking. So now I want to jump into the actual metric itself. So just looking at one of them, the goal is to create 100% of buildings that are within 100 meters of the safe cycle network. So a safe cycle network can be a path that has a protected space for cycling, physically protected space for cycling, or really slow street that facilitates cycling that has a low number of cars and low speeds of cars where you can actually share the space with motor vehicles. So again, this is a means of diagnosing the existing conditions, but also it helps to set goals for the city as you're thinking about the SUMP process. Some of the data sources for this include existing plans and designs, maps of the existing cycle network in the city. You could use satellite photography if up to date, or you can actually just survey the site yourself. In the next activity, again, we're going to go and do an analysis as a group. So I want you to think about this picture. So this is another example from India. We've done a lot of work there, so I'm gonna focus a little bit there. So this is a test cycle facility in India, and I want you to think about what you see in this image. So I'll talk about the four different types of safe infrastructure for cycling. So there's protected cycleways, there's slow streets that are of slow speeds and low vehicle volumes, and then there's pedestrian priority streets, and then walk and cycle paths. So as you look at this image, what do you notice? And you can enter what you see in the chat. And so again, use a plus sign to indicate something positive or a minus sign to indicate something negative. So I want you to think about as you look at this image, what are some of the things that are done well, and what things might be improved, and it might also be helpful to think about, okay, would you ride a bicycle in this area? Would you let a child ride a bike by themselves in this area? As a way of framing the analysis. So I'll leave the image up for another few seconds as you look at it, and I'm going to pull up the chat just to see what people are saying.
Hey Jacob, can you remind us where that picture was taken?
Yeah, I am forgetting the specific city name at the moment. Apologies. I can pull it up. I'm not going to have it. It's one of the cities in the Cycles for Change in India, but there are
Okay.
30 cities. So
India, and then we can follow up with that later. Thanks.
yeah, apologies. So there's not much vehicle traffic. People said that's a good thing. It's shaded, so that's good. It's narrow, so it's hard to overtake. There's not much protection. That's helpful. So if a vehicle were to pull into that space, you wouldn't have much protection. There's not much keeping you out except for those plastic posts. Yeah, it's unclear what the paved space at the back is for. So maybe people might use that for parking. These are great. These are great assessments of this. And this is the type of thoughtful analysis that I think would be really helpful in assessing cycling in a city, is to think about these things. So with that, I'm going to go ahead and wrap up this activity. And so the last one is we're going to look at pedestrians first. So I'm going to jump into the pedestrians first data, and hopefully this works well. So, May, if you could put a link to this in the chat, people can do this. What I want you to do is to go to the link that's on the screen or in the chat, and then find your city. And if you don't find your city specifically, so I'll show you, I'll do my city, I'll do Washington, D.C. and just search for it. And then it brings you to the city. So we're going to look at the block density in my city. So as you zoom in, you can see that you get more detail of the actual conditions in the city. And you can see where there are a lot of blocks, good connected street network. You can also turn on the population density to see where there's more people. So you can see there's a lot of people in this area and quite a lot of block density. If there's other areas with a lot of people, maybe not so much block density. Yeah, so here we go. Maybe these areas might be a good place to improve the street grid. And you can see maybe if we turn all of these off, that some of these street grids aren't very well connected to each other. So that might be an interesting way or an important place to look at better connections between areas. So what I'd like for you to do is to go to this, find your city or a nearby city, and then open up the map, and then in the chat, enter the name of your city, the block density, which you can find farther down. So this is the block density in Washington area. And then one observation that you've made, maybe one area that your city can improve in, or one thing that you noticed where there's maybe a lower block density or an area that's doing well in your city. Just one observation of what you think about the street connectivity in your area. So if you could go ahead and do that now, that would be great. So remember the name of your city, the block density for your city, and then one observation. So 3 things. Let me jump over to the chat to see. Results are coming in. So Harare, Zimbabwe. And so I'll just say that if you can't find your city specifically, you can go to a nearby city. So a bigger city that you know nearby. Let's see if there's other. Istanbul has 93 blocks. Yerevan has a lower block density, so Istanbul is doing quite well. The goal is 80 blocks per square kilometer, so Istanbul has met the goal, which is fantastic. And Bogota is also doing quite well. They have a very dense street grid and well-connected street grid. And I'm seeing that I'm not seeing a lot of observations. So if you can add an observation of an area that you think could be improved in the city, or an area that's doing quite well in your city, I think that would be really helpful in thinking about how this tool can be applied. Dakar in Senegal has a very high density of blocks, as does Bangalore. So these cities are doing quite well on this metric. And I should mention that the density of blocks is an assessment. It's a tool for thinking about your city. This is to help provide guidance and help you think about how these metrics can work. Help you to see what's going well. Help you point you to areas that may be improved. Areas that maybe are doing well already and you don't need improvement. Okay, just take maybe one more minute for people to go through and look. Hanoi has a relatively low. I may mention that New York has a lower block density because of New Jersey. And so that's one thing I should say about this, is that this tool goes beyond just the city area. So on this map, you can see the city of Washington, D.C. is this kind of rectangular area, but the measurement goes well beyond that, because the city, this is looking at the urbanized area, which is this red boundaried area. So it includes a lot of suburban areas in some cities. And in some cities, maybe this is smaller than the actual city boundaries. So this is a tool to help you think about it, and you can use it to help make better decisions.
Hey, Jacob, can you briefly address a question from Nicholas about when you have big areas that don't have blocks like parks, how is that accounted for?
Yeah, so this area looks at the average density in places that have a street grid. So you usually are not punished for having big parks in your city.
Okay.
But again, this is about providing information to you so you can look at it and assess it and make decisions about it. Not to say that this specifically is the only thing to consider as you create mobility plans for your city.
Cool, thank you. We're just kind of at 7 o'clock, or at the hour, so I'm wondering if we should move on. But Dilek has a question, if you could answer that in the chat once you're done. Thank you.
Okay. With that, I'm gonna go to the next section of the presentation, which is the case studies. So in this section, we're going to look at specific examples of diagnosis that have been done in some of ITDP's offices, or in Indonesia and in Africa, in several countries in Africa, and how those results were applied to the planning process. So I'm going to pass it on to Ghani from our Indonesia office, who will talk about public participation in diagnosis in Jakarta. So Ghani, I'll pass it to you.
Yeah, thank you, Jacob. Good morning, afternoon, or evening, everyone. My name is Ghani. Currently, I work at ITDP Indonesia. In here, I majority assist the government to build the bike infrastructure in Jakarta, the capital city in Indonesia. And I will try to tell our story about the participatory planning approach that we have done in Jakarta for the last 2 years, but especially for the cycle lane development. So to start, a little bit of background, the city of Jakarta has built the 63 of cycle lane in the last 2 years, including 11 kilometers of protected cycle lanes. The process leading up to that construction included a very different engagement strategies with the public as well as with the government. So this is not only provided planners with important insight, but it also helped to build the capacity of the local government and also the local stakeholder. Next, please. So planners in Jakarta use a variety of engagement strategies with the design process to address the different groups of the users. These include more formal workshops, sitting in a room together, as well as outside events with more hands-on interaction and feedbacks. This activity took place over 2 years, but the engagements could be more condensed if we need it. Next slide, please. So the most important first step was to get to know the users. From the field observation, we identify a highly diverse profile of cyclists who use the road day and night. Therefore, in designing the cycle lane, we have to ensure that we have to accommodate all their needs and to create an ideal and inclusive design through the public participation. Beside the diverse users we previously found, there are also other users that won't be covered easily in our previous general observation, such as the most vulnerable groups of children, the elderly, and also people with disabilities. We chose to directly engage with this group to receive a greater and more detailed perspective. Next, please. So in the Cycling Friendly Jakarta program, we did a focus group discussion as a first step. We invited the general public, the bicycle community, and also other groups to have an initial dialogue between them. In this case, we start from a fundamental discussion, such as mapping any physical issues, such as the existing facilities and also the infrastructures, and also the non-physical issues, such as the existing policies, the potential budget, and also campaigns that might be created in the future. In this series of activities, we also invited the participants to cycle on the field to see or capture any other issues which might be not covered in the first discussion. Then all these activities are summarized into a recommendation and also the action plans that will later be presented to the government in the form of consensus. Next, please. So after conducting hearings with the government and also to get buy-ins from them, we did the second workshop. However, this workshop is different from the first one because it involves both community and the government and has a more realistic output. The things discussed were varied, ranging from the cycle network planning, the design elements such as typology, the marking, and also the signage, the bike lane facilities such as the bike parking design, the initial bike sharing discussion, and the last one is the final output is the trial bike lane planning, which is covering the network, the timelines, the logistic requirements, and also the supporting events for this trial bike lane. So the result is we have 63-kilometer trial bike lane in total, which connects existing bike lane in the city and also a varied land use in the area. Next, please. So these pictures illustrate the journey that taken from we did a collaboration field survey with the public works and also the transport agency along the proposed trial bike lane route to see any obstacle or issues that might be or not covered during the previous planning, such as intervention at the bus stop, at the driveways, the parking zone, and also at the junctions. However, the 63 of the trial line itself is implemented using a tactical urbanization approach. So we only use marking and stick cones in here. Hence, the infrastructure is still flexible if you want to modify it. So after the first implementation finished, we did the monitoring and the evaluation process around 4 weeks long to assess the traffic impact, and we seek a volunteer from the public to check and do the monitoring along the trial bike lane. They have to do the cyclist count, the cyclist counting, a direct report if there is any violation made by the motorists or cars or motorcycle. And at this phase, we also did the permanent design concept, which eventually some of the lane segment were implemented with a permanent bike lane protection after 1 year trial process. Next one, please. So before the government community workshop, we held a cycling tour attended by the cycling communities and the government, which aims to be the first-hand experience by the government. A similar method was then used during the trial phase of the 63-kilometer trial cycle lane, where the governor himself joined the community and city agency representative to cycle along the trial lanes, which was followed by a sharing session with the cyclists, allowing them to share their inputs and suggestions directly to the governor. So as I mentioned before, for the volunteers, during the cycle lane trial from September to November, 1 month, we gathered input on cycling conditions through volunteer and community engagements. These volunteers observe the cycling lane condition and talk with other users to understand their perspective. We conducted more direct engagement activities with the communities to gather their perspectives and input so that the government, through Jakarta Transport Agency, could address a specific challenge through the pilot intervention and plans. Next, please. In November 2019, at the Car Free Day event, we tried to reach a wider audience by creating a public installation on their hope for a cycling-friendly Jakarta. So many people support and state their needs for the cycle lanes, and they even write down suggestions where the cycle lanes should be built. And the public also shared their concerns and challenges they experience in cycling. Next, please. So in principle, the public has experiential knowledge of the topics that the planning experts and professionals study. For example, if planners are studying data in order to prioritize planning decision, the public will know the people behind the numbers as well as the problems at the first hand. So that they will be able to complement or enrich the scientific and the technical knowledge with the actual examples from street levels, and can help to rank benefits for this approach, that they will infuse the dialogue or discussion with a local values and common sense, guiding a more intelligent and collaborative decision-making process. And again, the main goal of public participation are to create communication and dialogue, to access to information and the management of polarization in the decision-making process. And we also have to be aware of difficulties, challenges, and drawbacks, the lack of public engagements, the complexity of the issues, and the difficulty understanding the problem required planners must present a language that the public understands. We also have to clearly defining the rules and the roles of the public participation, whether they engage all of this had to be made absolutely clear in order to avoid disappointment and doubt in the future participatory process. Right, I think that's all from me regarding our story in Jakarta. Thank you for listening, and I'm passing back to you, Jacob.
Thank you, Ghani. So now I'm going to pass it on to Regatu Solomon, who's based in our Addis Ababa office in Ethiopia, to talk about walkway facility diagnosis in African cities. So Regatu, I'll pass it to you.
Okay, thank you, Jacob. So as Jacob mentioned, I'm Regatu Solomon from ITDP Africa based in Ethiopia. And in this session, we will talk about the type of data collected in African cities for the Sustainable Urban Mobility Plan studies, which mainly focus on Ethiopia Bahardar city and Kenya Kisumu city to improve walkway facilities. In the overall, it shows how the data were collected and used for better planning and decision-making purposes. So its content will be, it will have a different types of data collected, and where most of the data are collected by the group of surveyors through online different tools like Device Magic and Locus, and then finally mapped out by using GIS. You're going to see details in later sections. And you will also be able to get insights of how this data has been used to prioritize the different SUMP interventions. So next, please. Okay. So on the first data which is being collected is the footpath clear width. The clear footpath width, it's not only the overall width, by the way, it's the clear footpath width, which is specified as a pedestrian zone at the city level is measured in order to determine which streets have fulfilled the minimum walkway clear width, which is 2 meters. So for the survey, we use 4 different categories, as you can see, and which is done, of course, for Bahardar city. And those data, those mappings, as the result of those data will be used to inform planners to make interventions on the walkway to provide that minimum 2 meter clear walkway width. Next, please. Regarding the pedestrian volume data we conducted, we have conducted this one in a specific peak hour period, which is counted especially on major corridors of the city. And of course, the data include different society groups, and it should include, like, it will consider different gender types, age, and abilities. And once the data is collected, it is mapped to show the number of pedestrians in a specified direction, like is it one way or both direction. And the overall data will inform the city to allocate appropriate walkway, which is inclusive for all ages and different abilities. Next. So the third one is street vending. Such activities also affects the walkability in a positive and negative way when it is, of course, poorly managed. And this will affect the movement of pedestrians. And when they have proper space, of course, it will encourage walking. So for Bahardar, the survey is conducted on major streets within the city center where street vendors are expected. And the intensity of the vending activities mapped by categorizing as heavy, moderate, and low. Of course, this is going to be judgmental estimation, and such data will inform the city to decide on which corridors proper vending places have to be provided for street vendors according to their intensity, and in a way that will not prohibit the movement of pedestrians. Next. For the data collected on the shade, what we have done is, obviously, which is like for walking to be convenient and pleasant, sufficient canopy trees should be planted. So what we have done is data were collected on different streets during the high intensity sunlight. In our case, it's like in the noon time. So where it can help to identify what proportion of the streets has proper shade for the pedestrians. And those collected data will help the city to plan and provide shade using trees and other shade systems on the street. Next. For the streetlights, this will also affect walkability, especially during night times. And the presence of streetlight is surveyed at night time, where it could be checked not only from the streetlight poles, but also lights from the buildings. And the data were mapped, as you can see, to indicate good, moderate, and poor, depending on the intensity of the light. And from the result, on those streets that are classified as a poor or moderate light intensity, the city will be able to provide street lights or maintain the existing street lights. Next, please. We have also conducted on-street parking occupancy, where if those on-street parking are mostly poorly managed, and if they are poorly managed, they will negatively affect walkability by hindering the movements of pedestrians. And such data is conducted by measuring the proportion of the spaces that are occupied by parked vehicles from the overall street space. And as a result, from the result, what planners or the city can do is they will decide on parking management and allocation of parking on specific feasible places. And next. And for the crossings, at-grade pedestrian crossing should be encouraged, and non-functional and expensive footbridge should be avoided, especially in developing cities like Kisumu. As you can see the maps, the pictures are from Kisumu City, and different intersections could be assessed by site visits and documented with by using photos and videos to identify if there are very wide turning radii which encourage vehicle speed and make it unsafe for pedestrians to cross. And what you can do is provision of safer and inclusive crossings according to the desired line of pedestrians should also be checked, and which will include assessing the provision of refugee island for increased number of lanes. And such data will inform planners to identify spots for intersection redesigns, to incorporate traffic calming crossings. It might be also reducing curb radii to make universal access, and to incorporate different bollards. And the next one. Crash data has been also collected. Most of the time, such data is obtained from traffic police department and or emergency hospitals too, of course. And it is good to have geospatial information during the time of incident. And otherwise, it is manually encoded by using the name of the place recorded on the crash report. After processing the raw data, in a spreadsheet, or we do it in a spreadsheet, and it is mapped to identify more crash prone area according to data received from the respective Kisumu city. This one is for the Kisumu city. It is obtained from the traffic police department. It reveals that most crashes in the city occur on major roads, and this is mainly logical for other cities, including in Ethiopia also. Such result will be used by the city to prioritize locations for traffic calming crossings and intersection redesigns. Next one. The final data surveyed was household survey. Household survey sought respondents' opinions on how walkability can be improved. Locations with high pedestrian activities are selected to conduct the survey. The chart you can see is from the Kisumu city, and the recommendations obtained from the the respondents is summarized as you can see in the chart, and where most of the respondents recommend provision of better footpaths, safe crossings, and better lighting, and others also. This will help the city to prioritize which interventions, like to prioritize better footpaths and safe crossings and others. Next one. Okay. So all this data has been collected and how they have been used. The above discussed data can be used to develop like different plans and design projects, and also to prioritize different projects. The data are used to prepare for Bahar Dar Sustainable Urban Mobility Plan and for Kisumu Sustainable Mobility Plan. So normally the data were collected for the preparation of those documents in both series. Next one. The other uses to prioritize possible interventions, like recommendations for pedestrian walkway improvements, which includes recommendations to widen footpaths with less than 2 meters, as we have discussed earlier, to propose new footpaths to fill the gaps in the network. It might be also intersection retrofit, like to prioritize, for example, for Bahar Dar City, we do this one as part of the intervention. 85 intersection were identified for retrofits, and out of which 21 were major intersection and 64 were minor intersection. Traffic calming measures such as speed bumps, tighter turns, restriction on free turns, narrow lanes, and other remedies might be were suggested to be prioritized as an intervention. And this is all about this session, and I'm happy to respond to any questions. Thank you.
Thank you so much, Regatu. So now I just want to wrap up quickly, and then we can get to questions for Ghani, Regatu, or myself. So just some of the key takeaways from this. If you really want to stress that diagnosis can lead to a more complete understanding of walking and cycling in your city, that this diagnosis is really important for development of planning and implementation measures related to walking and cycling, particularly for sustainable urban mobility plans. And the last thing is that diagnosis tools can really help with that diagnosis, and many of them reduce the burden on cities for collecting data. They help to set goals and identify planning interventions as you move forward. So big high-level takeaways. And with that, I want to shift to questions. I know we had some questions in the chat. Thank you for putting those in. Yeah, now is the time for any questions that you have before we wrap up. We have about 3 minutes left in the meeting. And I know Verena has maybe a few final additions if we don't have any specific questions.
I have a quick question. Hi, this is May. I'm just going to jump in. What about the timeline it took to do the data collection from both Ghani's and Regatu's experience? How long did it take you to do the data collection for Kisumu or Bahar Dar?
So Regatu, can you answer that one?
Yeah, sure. Specifically for Kisumu, I'm not so sure about the time taken, but I will follow up on this one. But for Bahar Dar, I think it has been like in Mendes, like the data collection above for Mendes, I think. Yeah. If this is the question, I mean,
yeah, no, that's perfect.
Time.
Amy, if I answer the question for the cycling city in Jakarta, so the workshops, it's only about 1 or 2 days, Actually, yeah, I think actually 2 days is a maximum. So because we have a very series of activities, we have to do the discussion, and we have to test out cycling together on the fields, and we some kind of summarize it into the consensus draft. It takes maybe a week, but the overall process and also with the government itself, maybe it will take around 2 months to starting from the initial discussion with the communities, and eventually we are trying to do with the government to testing out our cycle lane trial in Jakarta. Yeah, maybe that's all. Thank you.
That's perfect. Thank you, guys. That was really illuminating.
Thank you very much. There's another question coming in the chat, but maybe regarding the time, can we just agree that you can maybe answer that question in the chat as well? I think that would be really great. And because then I would just like to also quickly inform you about some other things on the next slide. Jacob, maybe you can go ahead. So first, of course, thank you very much to Jacob, Regatu, and Ghani, and also for Aimee for sharing your insights and introducing how we can do a diagnosis for walking and cycling. I will definitely use the tools that you introduced and check them out in more detail, and I hope that all of you will do so as well. We will follow up, of course, with the materials of today, as well as the link to the recording that we are going to upload. And I know that also some people of you asked that if you could get the presentation as a PowerPoint. So actually, I have good news for you, because we are also working together with our colleagues from ITDP on making this whole training available as training material, so to enable other people also to implement a similar training. So we are definitely preparing that, but give us a little bit more time to get everything together, and then we will also let you know once this is available. I would also invite you to provide feedback to us. It's always good to know what we did good, but also what we can do better maybe. So my colleague is going to post a link in the chat that you can it will just take like 2 minutes. So please take that time to participate in the feedback survey. And there's also a quick quiz part. If you want to test your knowledge on what you learned today, you can also take the quiz, and then you'll also get a certificate of participation. And then just a reminder, or shout out to the upcoming sessions in the Mastering Mobility training. You can see that there are some sessions coming up in all the 3 different languages, English, French, and Spanish. So check out the topics. I'm sure there's something there for everyone. Especially, I want to highlight here the session on the 25th of May. That is going to be the 3rd session with ITDP on active modes of transport. And that's going to be about an important topic. It's all about the money and how to secure financing for walking and cycling in your city. So I hope that this is also of interest for you, and you can either scan the QR code to register for these sessions, or you click on the link in the chat, or these are basically the 2 ways that you can participate or register. And with that, I'm going to, close this meeting. Thank you again, everyone, for joining. Thank you for the speakers, and I hope that this was an interesting session. And I also hope I'll see you in upcoming sessions of the Mastering Mobility series. Bye.